I'm Dr. Stepien. I'm one of the retina specialists here, and I want to introduce you to the E-Synchrony board. This is a way to track our patients as they move through the clinic experience.
Come in the morning, turn on the screen, and click on this, log in. And we enter patients the night before. So we just go here, add patient, change the date, figure out what type of patient is coming in, add any comments that you would like to add, and then add patient. And that shows up on her schedule here. When the patient arrives, we're able to real time put them here when they arrive. If they happen to arrive early, we put them over here so that kind of pauses their time. So if they're half an hour early, it doesn't show wasted time for clinic. But if they're here on time, we put them here. Their charts go up here. The next person available will come grab them and move the card to whichever room number they're going to be in. So say we're doing 225 for this patient. So the fellow resident orthoptist will be checking them in, or a technician. Put it there. We can put their initials. So we have all of the initials here so that we're able to know who has the patient, where the room, what room they're in. There's also time how long a total time of that the patient has been here, and then also how long the person that has the patient has been with that particular patient. So once they are done, then we go to the next. If they're ready to see Dr. Bradfield, then we can scoot them right over here, ready for Dr. Bradfield, if we're putting them in one of her rooms. If they need a technician for dilation or pressure checks, we would move them to the tech area. Then the technician would come in, put their initials on it. So now we know who started the patient, and we also know who is currently with the patient. And again, we moved a different row or different column over, so it restarts that clock for that particular part. So once we do that, so say the technician is in there, we're done with the patient, we dilated, we did our pressures, whatever we need to do, then we move the patient to the lobby and move them to dilating. So now again, clock starts over. We also have a nice area here that we can change the time. So if we want the patient to wait, we usually wait 40 minutes for dilation. So we can actually change the time. I'm gonna put it on here I'll put the time for 3 minutes so that you can see what it looks like once the patient, actually, we'll go 1. So when it gets close to that 1 minute, you'll see a clock pop up, and that lets us know. So you can see that it's getting close to the 1 minute because it changed from green to yellow. Then it'll go to red, and then you'll start seeing the clock pop up there. Here's your clock letting us know that it is time to bring that patient to the next level. So patient's done dilating after 40 minutes. If one of Dr. Bradfield's rooms are not available, not open, then we will put the patient still in the lobby, but move them to the next column. So now we know they've been dilating for 40 minutes. They're now here. Again, the clock starts over. So once we're done with that, we're able to bring this patient into one of her rooms once they open. And she goes in, sees the patient, then we move it one more over when the doctor is seeing the patient. When she is finished, and again, that clock starts over every time so that she can keep track of what area they're in. So then when we're done, you can just click down here to done, and that's it.
so this board is a really great way to know, okay, who's waiting for a GC? Oh, it's patient A right now. Okay, I'm going to move patient A from waiting for a GC to with the GC, and then I go in to see them. And I'll know who they're going to see next. I can tell the patient they're going to see the doc next. I just feel like it's a good way to improve communication on busy clinic days when we don't always have a time to kind of sit down in between patients.